Hi, this is my topic presentation on the issue of shortage of experienced nurses. I'm Mary E. Lehman for Nursing 410, Issues and Trends in Nursing. The learning objectives for this presentation include, at the end of this presentation, the learner will be able to identify one reason there is a current shortage of experienced nurses. At the end of this presentation, the learner will be able to list at least two ways the shortage of experienced nurses impacts healthcare. And at the end of this presentation, the learner will be able to comprehend three impacts on society caused by a shortage of experienced nurses. I chose this topic, the shortage of experienced nurses, because this issue is extremely personal to me and relevant to what I am currently experiencing in healthcare. The issue of a shortage of skilled and experienced nurses is relevant because it has been and continues to be a global issue, and that's according to the authors Bell and Sheridan. Also, according to the same authors, the COVID-19 pandemic has further highlighted the dire issue of nursing shortages in general and the global necessity to have adequate numbers of nurses. I'm going to discuss some reasons why we have a shortage of experienced nurses, and one of those reasons are the baby boomers, those individuals born between 1946 and 1964. The U.S. population over the age of 65 is the largest that it's ever been. According to Herleth et al., baby boomers who are nurses are planning for and are going to be retiring in record numbers in the next several years. According to Bell and Sheridan, the COVID-19 pandemic has also expedited the retirement of some of these baby boomers earlier than they were planning. The COVID-19 pandemic has also caused other experienced nurses to leave the profession altogether. The Bureau of Labor Statistics Employment Projections 2019 through 2029 projects 175,900 openings for RNs each year through the year 2029 due to retirement and other workforce exits. And as I mentioned earlier, I believe the COVID-19 pandemic has probably raised that number even higher. According to Wan et al., the aging population in general is contributing to the issue of shortage of experienced nurses because there's more patients. The population has a greater percentage of individuals over the age of 65 than ever before, and so we need more nurses to care for them. Also, according to the authors Herleth et al., care is becoming more complex, so it's taking longer for nurses to reach that level of being able to be called experienced. Experienced nurses, based on my research, typically have been nurses for about 5 years or more, is what I'm finding is the general consensus for the number of years needed to work to be considered experienced. The influence on nursing practice because of a shortage of experienced nurses will mean that the nurses who remain in the field will be tasked with difficult workloads without adequate support. Experienced and inexperienced nurses will need to manage increasingly complex patients without adequate assistance, which leads to or can lead to burnout, which in turn leads to turnover rates that are higher and lack of retention of nurses. And I just want to share a quick personal experience regarding this issue. I was working one night, and I was actually the facilitator because I had the most experience at 14 months. And the rest of the nurses under me obviously had less experience or less years of experience. And we had a patient come up from the ED that had a PCA pump, and it wasn't working correctly. And nobody on the floor knew exactly how to fix the problem. So we reached out to our educators. We reached out to different units. Nobody was able to assist us. Some people didn't get back to us. Some just said we aren't able to leave our unit and come and help. So unfortunately, that the patient that had the PCA waited several hours without pain management until we could find somebody that was experienced, that had experience in PCAs, to be able to fix the issue, which was not good and was unacceptable. The impact on healthcare will include high costs. It takes a lot of money to train and retain nurses. High turnover. Nurses will become burned out because they don't have the support they need. There can be fewer available hospital beds because if there aren't nurses experienced to care for patients, then we can't have patients in hospital beds. Postponed care, treatment, and surgeries if you don't have the nurses that are experienced to care for them. Poor morale in general, nurses feeling like they don't have adequate support, and negative effect on patient outcomes as the worst case scenario of the impact of the shortage of experienced nurses. Impact on society includes risk to patient safety, risk to quality of care, risk of injury for nurses, post-operative mortality, and baby boomers also are educators who are also retiring, and so some colleges are having a hard time meeting the demand for more nurses. And what I'm afraid of is that because of these above issues, society is going to become less trusting of nursing as a profession. In conclusion, the shortage of experienced nurses is not a new issue, but continues to be an issue that impacts nursing practice, healthcare, and society. The COVID-19 pandemic has only worsened the shortage of experienced nurses and brought renewed attention to the issue. The U.S. population over the age of 65 is the largest it's ever been and comprised mostly of baby boomers. Today's patients are living longer and their care grows more complex. The shortage of experienced nurses impacts healthcare and society immensely, leading to concerns about whether the nurses that remain can provide quality care that is safe and does not lead to high rates of nurse burnout and additional turnover. The shortage of experienced nurses must be addressed so that nursing continues to be the trusted profession it has been historically. Here are my references. Thank you for watching.